I always like to make the point that the purpose of pilots are really to test something that we theorize, will make an impact and have a positive impact. We think it will work better than the status quo. And I presume that's really what you're doing here. You're taking a model, developing a model, perhaps informed by things you've seen elsewhere, by the literature, but extending it somehow and really trying to test whether this is a better way to address this issue. I guess, is that true?
Absolutely. I think it's critical that we be able to develop something and demonstrate along the way whether it's really the right solution. So this work is really building on some work that I conducted with colleagues at UC Davis, where we did demonstrate a model that was similar for pediatric patients, and we're able to show that there were significant differences in quality when people had access to telehealth. So the goal really here is, can a similar model work for adolescents and adults? And I think looking at some new and different things, how will we sustain and grow a workforce so that we do have an expert in every community is important. And I think in thinking about sustainability, we must demonstrate that it's cost effective, that we do improve quality, that we do enhance what nurses are, the pride that they have in their work and their ability to continue to do it because we're offering the training that they tell us they need, and we're offering other sorts of peer support and support for testimony, other sorts of things that they might find challenging in their role.
Good. Let's dive a little bit deeper into those if we could. I think when we think about, and you mentioned some terms, cost-effective, quality, I guess really we're talking about outcomes here. So those are some general categories. Anything more specific in terms of what you'll be measuring in terms of the outcomes, or anything in addition to those broad categories?
I think we will definitely look at, it's very costly for a hospital system to send a nurse for training. So we'll look at some models around how can we provide cost-effective training. And then ultimately, many nurses leave the field. They may get this expensive training and not feel supported enough to stay in the work, so they may leave after a year. That's expensive. Those are big hits to a hospital system that's already not getting really well reimbursed for providing the service. So I think we can look at, are we able to attract more people to the field because they may know that there's a presence of the safety center to support them as they go out and conduct live exams. And we want to be able to see, how satisfied are they in the work that they're doing? Do they feel supported? Can we change some of those dynamics about their satisfaction? I think we also want to look at how do people who are coming in and receiving the service, how do they feel about the service? How satisfied are they with their care, and can we make some movements there? And then I think we ultimately need to look at the quality of the forensic evidence that's collected. So we're working with crime labs across the state to do that, as well as looking at the photo documentation, as well as written documentation, giving that to an outside expert, and looking at that along with groups that don't have access to telehealth and saying, are we doing a better job of ultimately collecting a more forensically defensible case?
So really multiple outcomes, really covering a lot of different stakeholders, the patients, those providing the care, thinking about the hospital and its kind of financial position, but it also sounds like the criminal justice system. So I would imagine that cost effectiveness, when you talk about that, probably gets into successful prosecution rates and the degree to which the evidence supports the legal case and that sort of thing as well?
Absolutely. I think, when we look at the numbers of people who are sexually assaulted, we might be inclined to think that there are lots of perpetrators. But what is more likely is that there may be some of those perpetrators are very prolific. So if we are successful at prosecution, we may be successful at preventing another sexual assault. So I think there are lots of ways that we can sort of measure the impact, but we can certainly look at, if we train nurses how to present their evidence-based practice and what they're finding on exams and represent that well in court, that's another real area where we can have an impact and hopefully have an impact on prosecution.
And it sounds like you're doing some work there as well to train nurses how to sort of be involved in the legal process, because inevitably they might be called to testify.
Yes, they are. So that the complete process is that, maybe 2 or 3 years later, but you may ultimately be called to court to defend the work that you did. So while the work itself can be difficult, it's really quite daunting to be called to court and testify. It can be a scary environment. So I'm working with colleague here at Penn State, who's in the law school, to develop a training that is really to immerse nurses in the courtroom process, understand legal terms versus what are medical terms, and really help them to feel confident about what their role is in the courtroom, which is really to be objective and to talk about what their findings were, how they collected that evidence so that it really is admissible.
Probably something that's not typical in the nursing curriculum generally, right?
Absolutely not.